A very warm good evening to one and all. Welcome back to the today's session. I hope you are all doing well. Today we have our guest speaker, Dr. Namrata Trivedi, ma'am. Ma'am is an assistant professor from the Department of Anatomy. From R Shah Homoeopathy Medical College and Hospital, Rajkot, Gujarat. So we welcome you, ma'am. We welcome all the participants for the today's session. So ma'am will be talking regarding carcinosin. Uh, so today's topic will be regarding the carcinosin. So we welcome you once again, ma'am. Welcome you all the participants to the today's wonderful session. Hope you all enjoyed. Over to you, ma'am. The session is
Thank
all
you so
yours.
much, ma'am, for this introduction. Can I start, ma'am?
Yes, ma'am. Absolutely, ma'am.
Okay. Am I audible, na?
Hanji, ma'am. Hanji.
Okay. Good evening, one and all. Today we will discuss about the carcinosin homeopathic medicines from its pathology to the mental and physical features, physical symptoms. Okay. First of all, carcinosin was originally made from the discharge of breast cancer. You know all about the cancer. Carcinosin medicine was prepared from the breast cancer tissue. Okay, it covered the cancer myasm, mostly Sora syphilitic myasm. It belongs from the cancer myasm, Sora syphilitic myasm. Okay. Now the constitution. How patient looks like. Carcinosin patients look like a fair complexion, have a blue sclera, light brown flat skin patches. One of the characteristics of the constitution of the carcinosin medicine was cafe or lead spot, means having a light brown skin patches on her face. Has a numerous mole on face and she is a chili patient. Okay. Now the pathology. What type of pathology carcinosin cover? Carcinosin can be used as an intercurrent remedy. Now, what meaning of the intercurrent remedy? When we give a constitutional remedy to any patient, when we feel like then there is a stop action of the constitutional medicine, then we can give the carcinosin medicine if the symptoms match. Now, carcinosin medicine is also indicated in the constantly changing symptoms and state. Like one time patient is very happy, another time patient is very sad, alternating or changing symptoms like alternating side of pain in head pain or it also observed in back pain. It also can be used in cases of AIDS or in any cases of AIDS, any cases of symptoms which are similar to AIDS, like a periodical high fever, patient have a weight loss, swollen gland, long continued periodical high fever, emaciation and chronic severe insomnia or sleeplessness and chronic diarrhea. We can also use carcinosin in AIDS patient. Now the carcinosin medicine also used in hemophilia. Hemophilia is a genetic disease in which there is a deficiency of blood clotting factor. Carcinosin can be used in hemophilia. There is any hemorrhage from any orifice of the body. Carcinosin can be also used in pernicious anemia or any family history of pernicious anemia. Pernicious anemia is the autoimmune disease in which there is a deficiency of intrinsic factor and there is a no absorption of vitamin B12. Okay. Carcinosin can also be used in cases of thalassemia and also can be used in ailments from blood transfusion in cases of thalassemia. You can see many patients of thalassemia having a regular blood transfusion. If there is any patient having a blood transfusion due to thalassemia and having any side effect like a chronic exhaustion, fatigue, any keloid egg or eczema develop after the blood transfusion, we can also give the carcinosin to those patients. Carcinosin can also be given in the retinal hemorrhage. There is any complaint due to anticipatory anxiety, stage fear. Carcinosin can antidote the ill effect of vaccination like a thuja and silicea. We can give thuja and silicea in cases of vaccination having any symptoms, skin symptoms like eczema or fever or pain after vaccination. We can also give the carcinosin as well. We can give thuja and silicia. Okay. Carcinosin can also give in the patient have a tendency to inflammation, like inflammation of joint, rheumatism or rheumatoid arthritis or cervical spondylitis. Okay. Now, carcinosin can also be given in the cases of mononucleosis. Mononucleosis is a viral infection. It is due to the EBV virus, Epstein-Barr virus infection. If any patient of mononucleosis having a viral infection due to the EBV virus, then after she will or he will never get well since. We can also give the carcinosin to those patients. Okay. We can also give the carcinosin to the patient of pneumonia. After the pneumonia patient never well since. We can give carcinosin to those patients who have a tuberculosis, or we can give as a prophylaxis in cases of tuberculosis. Any history, family history of tuberculosis, or there is any exposure to tuberculosis bacteria. Okay. Carcinosin have a phobias like sea bathing aggravation. He has aversion to bathing or washing, or in contradiction, carcinosin is very fast DS patient. Yes, there is a contradiction. Patient have a aversion to bathing or washing, and patient is very fast DS. There are two pole in carcinosin patient. Yes. Carcinosin medicine also give at the time of menopause. There is a hot flashes with perspiration. Complaint are annual periodicity is seen also in the complaint, like a every complaint seen in the every year, like a headache. Headache is hello. Hello? Can I audible, ma'am?
Ma'am, आप audible हो ma'am.
Okay. Okay. Carcinosin can also given in the patient of annual periodicity, having a complaint which are recurring every year. Okay. Carcinosin can be also given in the symptoms which are alternating inside, like a headache on right side, then second time headache on left side, alternating symptoms on both side. Now, L-menstruum, in which factor we can give carcinosin. L-menstruum, fright. Fright means long-lasting fear, long-lasting fright, long-lasting unhappiness or grief, like a patient having a grief from long since, or having a acute grief. Carcinosin also can be given in the anticipation, elements from strict parents with lots of discipline. Children have strict parents, lots of discipline, lots of suppression in the children, and there is a too much expectation from children from the side of the parents. There is also suppression of the emotions. Elements from reprimands. A carcinosin patient is very sensitive to reproaching, reprimands, sensitive to criticism. Okay. Carcinosin elements from loss of sleep, insomnia, loss of sleep from nursing loved ones. अगर कोई नियर बाय रिलेटिव है जिनकी तबीयत खराब हो, तो उसकी केयर करने में उसे बहुत टाइम ऐसा हो सकता है कि उनकी पूरी तरह से नींद भी ना हो. Elements from night watching, elements from nursing of loved ones, elements from sexual abuse victims. Okay. Now, you can see the list of elements from in which we can give the carcinosin medicine. Now the modalities. Aggravation from C, aggravation in afternoon, aggravation from 1 to 6 p.m., aggravation from consolation, amelioration from C. Now you can see the contradictory symptoms. One, there is aggravation from C. In another, there is amelioration from C. Like a fastidious, carcinosin patient is very fastidious. And another side, carcinosin patient is very dirty, aversion to bathing, aversion to washing. Okay, amelioration in evening time. Okay. Now the mental syndrome. Carcinosin medicine is belongs to the cancer medicine. The main feeling of carcinosin medicine is the survival depends on the performance. He performed the task. He will be successful. He want to be successful because of survivalence. he thinks that if he not performing tasks, he will not successful in his life or her life, there is a death or destruction. He wants to perform, he need to perform. He he goes he's beyond capacity. He's taking a task, he's performing a task beyond his capacity for successful. Now, the patient is stretched themselves almost to the hope of success because the failure means the death or destruction for them. He has to success in life. He has to perform all tasks because there is strict parents. There is a lot of expectation of the parents on her child. He have to successful because of survivals. Carcinosin patient is very passionate people, very strong, very industrious peoples. He has to successful in this in his life. Patient is very fastidious, very cleanliness, wants things in neat and clean. Everything must to be in the order. Carcinosin patient is like artistic things like a dance, like painting, like drawing, like music, like beaches, like seashore, thunderstorm and lightning. It's like a nature. Okay. Yes, carcinosin patient is very sensitive like a plant, like Ignitia and Passadilla. If you scald carcinosin patient, we can see the elements from reproaching, elements from repents. If we scald the carcinosin patient, it's leads to any another complaint. Like patient is very sensitive, like Ignitia and Passadilla, does not like reprimand, does not like reproach, is very sensitive to criticism. He is very fastidious, wants everything perfect and neat and clean because he does not like anyone will criticize him, will reprimand him or reproach him. Okay. He is very sympathetic like a phosphorus. He he do everything for others, love for others, very caring for others because he is very sympathetic as well as empathetic to others. He is a perfect partner, like a perfect parents, like a perfect mother, like a perfect father, like a perfect husband or wife, because he's do everything for others, not anything for him or herself. Everything doing for others, like doing something for other happiness. Wants to happy his parents all the time. Wants all things for her parents is all inner suppression, inner emotions are suppressed. He wants anything for others, not for himself. Okay. Having anticipatory anxiety is any if carcinosin patient giving any task, he is anticipatory anxiety before that. He wants everything in neat and clean, very fastidious, wants things in a arranged manner. Like if he arranges a party in the house, he wants everything should be arranged neat and clean with curtain is also matched with furniture. That type of fastidiousness, that type of perfection is will you will found in the carcinosin patient. Now, the children. The children are very sincere, very well behaved, and well mannered. You can see the children of Carcinosin very sincere, very well behaved. Never criticize his parents. Everything do for her parents, his parents. He is like a slave for her parents. Uh, can be seen autism can be seen in the patient, mental retardation, ADHD, attention deficient hyperactivity disorder, and there is a chronic terror means there is many fear, many fright since childhood, but he's suppressed her all emotions, her all fear in themselves because they wants to be a happy. He wants to वो दूसरों को खुश रखना चाहते हैं, दूसरों के लिए जीना चाहते हैं, इसलिए वो सारे अपने इमोशंस अपने कंट्रोल में रखते हैं. जो भी इमोशंस है वो अपने सप्रेस करते हैं. नेवर वेल सिंस फियरफुल टाइम. जब भी उनको डर लगा है, वो कोई भी टाइम वो अपना भुला नहीं पाते, जब से वो उसे डर लगता है उस टाइम से वो कभी भी नेवर वेल सिंस। नाउ there is any history of suppression or abuse during the childhood. There is a too much responsibility at the younger age on the child. Child has to be better in life. Why? Because he wants to be happy. Her parents, her mother, her father. He that's not patient like that. He live for others. He has to be happy. He has to be doing things for others, not for himself or herself. There is a lots of parental domination. Mother or father domination or parental domination is found in the carcinosin children. In the opposite direction, carcinosin patient is very sincere, children very sincere, very well behaved, very well mannered. In opposite direction, opposite pole, children are also restless and destructive outburst. If he suppress his anger from long time, then at the point where he is outburst with destructiveness. मतलब अपना सारा गुस्सा एक साथ निकाल लेंगे, लाइक स्टेफी से दिया. Now, we can give carcinosin in the patient. Then there is any history of infectious disease, tuberculosis, mumps, measles, chickenpox, malaria, typhoid, or cancer. Or we can give patient having a or family history of asthma or cancer. Okay. Now we can see the using Carl Jung's system of personality. Carcinosin is the has earth and water predominantly, making them carcinosin is very down to earth, very realistic patient, very practical patient. Carcinosin is very down to earth, like a medicine like a calcula carb, pulsatilla, graphitis, and kali beach. Patient is very down to earth, very practical patient, very realistic patient. Now, how healthy carcinosin is balanced between the introvert and extrovert. Means carcinosin it can be the introverted, can be the extroverted, depends on the situation. Carcinosin patient is generally warm, affectionate, wants to live in company, desire for company, but sometimes they also needing time for himself or wants to remain alone. Carcinosin is the earth mother, naturally which attenuated with the earth like a phosphorus. He also like a nature, he also like a mountain, a place where there is a loads of nature, there is a no artificial things, like a phosphorus. There is a sensitiveness. You can see the carcinosin patient is very sensitiveness, wants to do things for others, wants to be happy, wants to do things, wants to himself, wants to live for others. So the carcinosin patient is very sensitive, can lead to codependency, means live for others, give have a no internal emotion. He all suppressed her emotions like any anxiety, any fear. These all symptoms, all emotions are suppressed for others. So, carcinosin patient is very sensitiveness and can lead to codependency. Means they are dependent on other for her happiness or his happiness, which leads to messy relationship. They are lives for other, live for other, and there is a codependency. Means दे आर हैप्पी फॉर अदर्स. अगर उनको खुश रहना है तो उसको दूसरों को खुश रखना पड़ेगा, वैसी बात है. कोडिपेंडेंसी ऑन अदर एंड देयर इज अ मेसी रिलेशनशिप्स ड्यू टू देयर सेंसिटिवनेस, ड्यू टू देयर कोडिपेंडेंसी. They are very loving, very caring for others. They tend to be in relationship as the caretaker. Like you know na, if in family member, if anyone is have a disease or anyone have any suffering, so carcinosin patient is sit with her, sit with him, and uh, very sympathetic, very care, very loving for him. वो पूरी रात भी जग जाएगा उस पेशेंट की, उस फैमिली मेंबर की केयर करने के लिए. मतलब कार्सिनोसिन पेशेंट इज केयर टेकर ड्यू टू हिज टेंडर हार्ट, लो सेल्फ एस्टीम एंड इमोशनल रेडीनेस. उसको भी प्यार चाहिएगा, उसको भी लव केयरिंग चाहेगा, इसीलिए वो दूसरों को केयर करेगा, दूसरों को लव करेगा, बिकॉज his survival all depends on the others. He live for others. There is a tendency to have a history of unhappy childhood. Any history of like a parental domination, mother or father separated, there is any history of mother or father separated, any unhappy childhood, any uneventful event occur in the childhood. Empathy and intuition makes carcinosin type gifted healers. Gifted healer means अगर कोई भी कार्सिनोसिस पेशेंट होगा, किसी को भी दिक्कत होगी, उसके फैमिली मेंबर्स, उसके फ्रेंड्स, इवन इन स्ट्रेंजर्स, they are giving they are like a caretaker, caregiving, giving love to other, empathetic. मतलब अगर कोई भी पेशेंट अगर कार्सिनोसिस पेशेंट कोई भी लोग ऐसे देखेंगे लाइक वेरी वेरी फियरफुल है, वेरी सैड है, तो उसके लिए कुछ भी करेंगे वो लोग. दे आर लाइक अ गिफ्टेड हीलर्स. There is a great contradiction in the carcinosin. We can see that there is a carcinosin patient is very fastidious, very neat and clean. In another side, he is very dirty. He is like aversion to bathing and does not like bathing, aversion to water. Like there is a many symptoms in carcinosin is contradicted. Like for example, there are the fastidious in the carcinosin, extraordinary fastidious, wants neat and clean everything. It's a syphilitic patient, syphilitic trait. At the same times, there are also dirty habits and aversion to bathing, aversion to water like a sulfur. It's a soric trait, soric patient. You can see the psora-syphilitic combination, psora-syphilitic miasm. Syphilitic means fastidiousness, very extraordinary tidiness, neatness, cleanliness. And in another side, he is a dirty, aversion to bathing, aversion to water, like a sulfur, anti-soric miasm. Okay. Again, the patient is very intellectual, memory sharp, very intelligent. But on another side, he is a child is a very dull, very problematic child. Like we can see, carcinosin can also be given to the autism patient of the ADHD. Like patient is sometimes the patient is very intelligent, highly intelligent, memory sharp. On another hand, we can give also the patient who is a child who is a problematic child, dull, and also can be given in the autism patient, in the patient of ADHD. Okay. Now, we can also see the contradiction in the constitution, in the appearance of the patient. Like some patients are very flabby, bulky with overgrowth, and on another hand, patient is very thin, lean, emaciated, like a picture of malnutrition, marasmus. So, carcinosin is also given to the patient who are very flabby, bulky, and overgrown, and also given to the patient who is malnourished, thin, lean, and emaciated. Okay. Patient is like thunderstorm, like lightning, like a sea bathing, like beaches. Even he can do the activity which is full of danger, like a mountaineering and sea. But in some patients, we find opposite fear, very fear. We can give the carcinosin remedies to those patients who like nature, who like lightning, thunderstorm. But on another hand, we can also give the carcinosin medicine to the patient who have a full of fears of nature and many things. Contradiction you can see. Okay. Now the guiding feature. Guiding feature of carcinosin is even in young boys and girls, but surprisingly enough, they do not feel very weak or unfresh from lack of sleep. Uh, if carcinosin patient is not sleeping many days since many weeks, but you cannot see on her faces. Like carcinosin patient अगर कई दिनों से जगता रहता है, सोया नहीं है, दिन में 2-3 घंटे ही सोया है, फिर भी आप उनके फेस से आप जज नहीं कर पाते, आप देख नहीं पाते कि carcinosin patient इतने दिन से सोया नहीं है. This one is the characteristic guiding features of the carcinosin remedy. There is a lack of sleep due to the nursing loved ones, due to the disappointment, failure in exam, or failure in business, or persistent anxiety. Chronic insomnia is result from the failure, disappointment, or failure in exam, or business, or persistent anxiety, or also can due to the नर्सिंग ऑफ लव्ड वंस. अगर किसी कोई बीमार है फैमिली मेंबर्स में, उनकी देखभाल करने के लिए अगर सारी रात जगता भी है तो उनकी वजह से भी उनको इंसोम्निया हो सकता है. Now, also can be given in the delay healing of wound and tendency to easy bleeding, like a cancer ulcer. You can see the cancer ulcer is not healing. There is a delay healing of cancer wound. Same, we can also give the carcinosin to those patients who have a delay healing of wounds, like a diabetes patient, and there is a easy bleeding, tendency to easy bleeding. We know that cancerous ulcers refuse to heal and bleed easily. So, if there is a manifestation are found in the precancerous or non-malignant cases, when can give the carcinosin if symptoms match and if strongly indicated. Now, patient has an intense fear without any cause. Patients are fearful from childhood. We can see ailments from suppression. Patients are very fearful from childhood, but cannot outward expression of that fear. अगर चाइल्ड को अगर कोई चाइल्ड है जिसको कोई चीज से डर लगता है तो उनके पेरेंट्स को भी नहीं पता चलेगा कि उनको इन चीज से डर लगता है. जब भी ऐसी सिचुएशन आएगी तब उनको पता चलेगा कि ओह मेरे बेटे को भी इस चीज से डर लगता है, मतलब suppression. The patient is very fearful from childhood, but there is no outward expression of that fear. Hence, those near and dear to the patient may not be conscious of it for many years until the any incident reveal it that he has a fear of that particular things. Now the fear. Carcinosin has a fear of health, fear of cancer, fear of exams, fear of crowd, fear of high places, fear of death, fear of death, fear of being alone, and fear of not being able to accomplish their goals, because his survival all depends on the successfulness. If he is not successful in given task, it means death to them, it means destroy to them. He has to perform. He has to overextend itself for performing a task and successful in that particular task. Okay. You can also see the contradictory symptoms in the fearfulness, like a patient is very brave, very courageous, and on another hand, patient is very fearful. Now, we see the physical particular characteristic of the carcinosin patient. Abdomen. Patient having an inguinal hernia, especially in the child. Chronic ulcerative colitis, pain like this pain is the characteristic of the carcinosin patient. Pain like burning, pain like a fire. आग लगी हो ना, आग जलाई कैसे हो, इस तरह से पेन होता है कार्सिनोसिन पेशेंट में जब भी अल्सर होते हैं पेट में तब. Now the back. Carcinosin can also be given in the cases of spondylitis, itching in the thoracic region and in between the scapula while undressing. Breast. There is a swelling and tenderness before the menses. Carcinosin can also be given in the cases of breast cancer and also can be given in the there is any family history of cancer or any family history of breast cancer. Ears. Now, carcinosin patient have a boils inside the ear, or there is an alternative ear, like we can see in starting slide that there is alternating symptoms or alternating state of the patient. You can see the alternating symptoms, boil inside the ear, one after the another in each ear. पहले राइट ईयर में बोल होगा तो फिर दूसरे टाइम जब हुआ तब लेफ्ट ईयर में बोल होगा, मतलब अल्टरनेटिव सिम्टम्स. You can see the alternative symptoms in the ears. Now the eyes. There is a soreness in the eyes, weakness of eyes, blue tinge or spots you can see on the sclera of the eyes. Especially it is noted in the children. There is a blueness of iris, corneal ulceration, and you can give the carcinosin in patient of retinal bleeding or retinal hemorrhage, because the carcinosin patient is carcinosin medicine is the syphilitic mycin and cancer mycin. Now the face is a brown cafe ou lead spot. We earlier discussed about the cafe ou lead spot, means patient having a dark brown light spot on the face, copper colored pale face, and heat flushes in the face during, especially during the menopause, bluish lips, stiffness of lower jaws, and it can also be given in the cases of facial paralysis. The female has a frequent menses, too early or too soon menses. There is a bleeding in between the two menses. Increased sex drive, disposition to masturbation, or too frequent or too early masturbation. It can also be given in the uterine bleeding after the sex. Now the head. There is a head. Carcinosin can also be given in the head injuries, like we can give in natrum salt. There is a consistent feeling in the hand, contraction sensation in the brain, heaviness in the forehead, and head injuries. Tired feeling with headache on side. Headache can also be seen in the alternating side, like one time headache on the right side and another time headache on the left side. Headache is alternating sides. Can also be given in cases of headache after the excitement of emotions, or headache after any injuries, headache after the childbirth. Okay. Now the respiratory symptoms. We can earlier seen that carcinosin medicine can also be given if there is any history or any family history of asthma. Now, the carcinosin medicine have a difficult breathing after running, asthma, and recurring bronchitis. Asthma after fright, after wet weather, or in the morning, forenoon or at the 10 a.m. Chronic pneumonia in the children. Cough is worse after talking, laughing, yawning, undressing, and tickling in the throat causing coughing. Now the male. Male have an increased sex drive, disposition to masturbation. In children, same we can earlier seen in the female. Troublesome or wanting erection, and can also be given in the cases of condylomata. Now the fever. We can see in the earlier case, carcinosin can also be given in the mononucleosis cases, where there is a never well since mononucleosis. Mononucleosis is the viral infection. It is due to the Epstein-Barr virus. Now, carcinosin is given in the cases of high fevers, which is unknown origin. Can also be given in the influenza, constantly relapsing complaint, constantly relapsing fever. Never well since influenza, acute or chronic mononucleosis. There is any recurrent history of glandular fever. Can also be given in the rheumatic fever in the childhood. If you know, rheumatic fever means it also can affect on the heart. Okay. Now the sleep. Carcinosin is very good remedy for the insomnia. Either is chronic or acute insomnia, causeless insomnia, or insomnia from the grief and mental activity, sleeplessness from anticipation or any anxiety, sleeplessness from losing loved ones, because carcinosin patient is very sympathetic and very empathetic. He is very sympathetic, doing all things for others, life for others, and uh, his survival all depends on the other. Wants to happy her parents always. So, sleeplessness from nursing loved ones, child must be carried or rocked to sleep. Means अगर कोई बेबी है, अगर सुलाना है तो कंपल्सरी उसे कैरी करके रॉक करना पड़ेगा, तभी बेबी सोएगा. Carcinosin patient. Same patient can be seen in the Sina and Chamomilla baby. Okay. Now the relations. Uh, we also discussed earlier. Then carcinosin medicine can be given in the intercurrent remedy. As an intercurrent remedy, when there is a constitutional remedy stop to act. Consider this remedy when other well-indicated remedies don't work or improvement don't last. It can be compared with tuberculinum, thuja, medorinum, syphilinum, sepia, netramur, calcula fost, dyscrosia, lycopodium, phosphorus, soridum, arsenic iode, pulsatilla, sulfur, and opium, illumina, and staphysalia. But in the cases of cancer, we can compare this remedy with the arsenic, hydrastasis, bufurana, conayum, phytoleca, Asterium rubrum, and sclenum. And third, phosphorus. We can also compare with the phosphorus, sepia, arsenic, medolinum, thuja, and coculus. Okay. Now the doses. In which doses we can prescribe carcinosin? Generally, carcinosin can also only prescribe in 30 and 200 medium potency. It is very harmful to prescribe in the 1 potency. Very experienced physician can give in the 1 potency, but it is well to start with the 200 potency, medium potency, and 30 potency. Okay. Ma'am, any question from any students?
Thank you, ma'am. Thank you so much
I
for the
can't.
wonderful session. Now we'll be moving on to the question and answer session, ma'am. Respected, हाँ जी मैम, आप कुछ बोल रहे थे मैम? Respected participants, if you have any questions, comment in the comment box. As well as there is a link shared for the registration form to get the e-certificate. And also we have shared the WhatsApp link and other social media platform link of the Aisha to be a part with us, so to attend the further webinars from our side. So we would like to welcome all you onto the board. Thank you, ma'am. And ma'am, how about could you comment on the action of carcinosin on a liver, ma'am? Liver issues?
Yes, carcinosin can also be given in the liver issues like a cirrhosis of liver. But my personal experience is that I be, I give the carcinosin patient of the migraine and in patient of the eczema on the face. In both patients, there is a history of asthma or any history of cancer. I observed that carcinosin patient have any family history of asthma or cancer.
Acha. Okay, ma'am. And there is a question from the participant, ma'am. They are asking, ki, ma'am, have you given this medicine in any cases?
I can't hear you properly.
There is a question from the participant, ma'am.
Yes.
So the question is like this, ma'am. Ma'am, have you given this medicine in any cases? They are asking, have you given this medicine in any cases? That's their
Yes, yes.
question.
I given this case carcinosin remedy in the patient of migraine. There is a migraine since 10 years. Patient having a migraine since 10 years. Patient having a migraine with loss of appetite. हेलो.
हाँ जी मैम, आप ऑडिबल है मैम. हाँ जी.
ओके ओके. मैंने कार्सिनोसिन पेशेंट एक पेशेंट को दिए जिसको माइग्रेन था सिंस 10 इयर्स हैविंग अ माइग्रेन्स. उसको माइग्रेन जब भी होता था तब भूख नहीं लगती थी और जो देयर इज अ ड्राइनेस ऑफ with the vomiting, with the blurredness of vision, and there is a in the mental picture, having his a grandfather have a cancer. Grandfather को कैंसर था एंड पेशेंट हैविंग लाइक डज नॉट लेट. हेलो.
हाँ जी मैम, आप ऑडिबल है मैम.
ओके. जो भी पेशेंट था ना उसको कैसा था, मैंने जैसे बात की ना कि जो भी उसके पेशेंट जो भी पेरेंट्स थे, जो भी इसमें ऐसा था कि उसके फादर थे ना वो एक्सपायर हो गए थे और फादर ने दूसरी शादी की थी. तो अभी जो मदर थी ना वो नई वाले थे, मतलब उनको उसको खुश रखना था. उनके जब उनके पास जो भी आउटपुट आते थे, जो भी पॉजिटिव आउटपुट आते थे, वही उनको चाहिए थे। मतलब उसको दूसरों को खुश रखना था, स्पेशली उसकी मदर को। हेलो।
हाँ जी मैम।
एंड देयर इज आल्सो ही इज ही जो भी उनके इनर इमोशंस थे, अगर किसी के साथ झगड़ा हो जाता, लाइक हिज पेरेंट्स और हिज सिस्टर, तो जो भी चीज थी वो पेन्स और पेपर से बुक्स में लिखती थी। इन केस
हम्म।
लाइक अ पोएम, लाइक अ पोएट्री, लाइक अ शायरी। जो भी अंदर के इमोशंस थे वो किसी के साथ शेयर नहीं करते थे। लाइक मैंने बोला ना, अगर रोना भी आए तो किसी के सामने रोते नहीं थे, क्योंकि अगर किसी के सामने रोया तो फिर और कौन क्या सोचेगा, उनको अप्रिसिएशन नहीं मिलेगा। जो भी नए मोम है उसके, वो उसके साथ बिहेव नहीं करेगी अच्छी तरह से। इसलिए वो सारे इमोशंस अपने सप्रेस कर देते, और जो भी उसको इमोशन से रोना आता था, किसी के साथ झगड़ा हो जाता था, कुछ भी हो जाता था, अगर कोई उसे कुछ भी बोल देता था, वो बुक्स में लिखते थे। वैसे बुक्स अभी भी उनके पास पड़ी है, बुक में लिख के थे। मतलब सारे इमोशंस अपने सप्रेस करते थे दूसरों की खुशी के लिए, स्पेशली फॉर हिज मदर, बिकॉज हिज फादर इज डेड ड्यू टू द कैंसर एंड हार्ट फेलियर। एंड I give the carcinosin medicines, carcinosin 1 then after repeated after 2 months, and after that there is a lot of relief in his migraine, only heaviness. Hello. um, Hello.
मैडम
हाँ
प्लीज
जी
कंटिन्यू।
मैम, आप सुना।
मैडम प्लीज कंटिन्यू।
हाँ, आप
um,
सुनाई दे रहे थे मैम।
नहीं, सुनाई नहीं दे रहा है मुझे अच्छी तरह। हेलो।
हाँ जी मैम,
मैडम
आपका आवाज आ रहा है मैम।
ओके
हम
ओके।
लोग हम लोग मीट।
आज लगभग 2 साल हो गए उनको, पेशेंट को केस चल रहा है उसके। आज तक उन्हें बहुत सारा रिलीफ है। जब भी एक्यूट एपिसोड आता था तब मैं अल्टरनेट रेमेडी और कॉम्प्लीमेंट रेमेडी देती थी, लेकिन आज बहुत सारा रिलीफ है। जब भी माइग्रेन होता था तब उनको भूख नहीं लगती थी, पूरा मुंह सूख जाता था। अब सिर्फ हैवीनेस होता है, वो भी कभी कभी, लाइक वंस इन अ 15 days। देयर इज अ lots of relief to the patient.
अच्छा मैम, अच्छा मैम। मैम, आई थिंक देर इज a couple of questions also from the participants, ma'am.
Okay.
Just I will have with you, ma'am.
Okay.
देर इज एन अनाउंसमेंट फॉर द पार्टिसिपेंट। जिन्होंने पहले फिल किया है उन लोग मत फिल कर दीजिए, जिन्होंने अभी आया है they can fill for their e-certificate. Okay, I hope you guys are clear. And moving on to the next question. History is necessary for carcinosin. Someone is asking like this, ma'am.
Yes. History of, hello,
हाँ जी मैम, आप बताइए मैम।
हिस्ट्री इज फैमिली हिस्ट्री के बारे में पूछ रहे हैं, किसके बारे में पूछ रहे हैं? मुझे क्वेश्चन समझ में नहीं आया उनका।
हाँ जी मैम, आई थिंक द क्वेश्चन इज ऑल्सो they have written in nail psoriasis. So I would like to tell that participant family history बोल रहे थे मैम, family history.
फैमिली हिस्ट्री ऑफ सोरियासिस में दे सकते हैं या नहीं, वैसा बोल रहे हैं?
No, no ma'am. They are asking, is family history is necessary for carcinosin? That was their question, ma'am.
नो, देयर इज हिस्ट्री ऑफ कैंसर, फैमिली हिस्ट्री ऑफ कैंसर इज नॉट नीडेड। आप जो भी कैंसर
Uh,
कार्सिनोसिन पेशेंट के लोग हैं, उनकी जरूरी नहीं है कि फैमिली हिस्ट्री में कैंसर हो ही। मैंने बोला ना, अस्थमा भी हो सकता है फैमिली हिस्ट्री में, तो भी हम दे सकते हैं। कैंसर हो तो भी हम दे सकते हैं। और इफ सिम्टम्स इंडिकेटेड, इफ सिम्टम्स मैच, वी कैन गिव द कार्सिनोसिन टू एनी पेशेंट, बट विद द कॉशियस, नॉट विद द हायर डोज। ऑलवेज गो विद द 200 और 30।
मैम, बात ऐसा है कि दे वुड लाइक टू आस्क कि फैमिली हिस्ट्री लेना जरूरत है क्या मैम
यस,
करके पूछ रहे थे मैम।
फैमिली हिस्ट्री लेना जरूर, यस, देयर इज अ मस्ट नीड फॉर ऑफ फैमिली हिस्ट्री इन एनी केसेस।
लावन
क्योंकि
मैम, लावन मैम ऑडियंस को बोलिए स्पीकर ऑन करके बात करने के, क्योंकि उसका मैसेज जो कर रहा है ना क्लियर नहीं है, क्वेश्चन क्लियर नहीं है, उसको बोलो।
हाँ हाँ, हाँ जी सर। पार्टिसिपेंट नेम भविष्य, यू कैन अनम्यूट योरसेल्फ एंड हैव अ टॉक विद मैम। या
आप हिंदी, भविष्य जी आप हिंदी में बोल पूछ सकते हो, कोई बात नहीं है। लापन मैम, मेरा एक क्वेश्चन है, हम लोग क्या इसके पैथोलॉजिकल साइड देखेंगे, पीएनएम टीएनएम करेंगे क्या जो पेशेंट आएगा?
क्या करेंगे सर?
टीएनएम साइज जो होता है ना, कैंसर का जो स्टेज होता है, स्टेज 1 स्टेज 2 स्टेज 3, टीएनएम का
यस
साइज
यस।
कितना है, T0 N0 MX और N2 N5 जो होता है, वो क्या करना जरूरी है कि हम लोग का?
नहीं नहीं, कोई ऐसा कोई करना जरूरी नहीं है। कार्सिनोसिन कार्सिनोसिन मेडिसिन देने के लिए कुछ ऐसा रिपोर्ट करवाना जरूरी नहीं है कि कैंसर कौन से स्टेज में है, फर्स्ट में, सेकंड में, थर्ड में है।
तो
मैम, यस यस प्लीज।
हाँ, अब मैं वो पूछना चाहती हूँ कि कार्सिनोसिन मेडिसिन प्रिस्क्राइब करना है तो फैमिली हिस्ट्री में कार्सिन कैंसर की हिस्ट्री होना चाहिए कि नहीं?
नहीं, ऐसी जरूरी नहीं है मैम। अब मैंने एक पेशेंट को दी थी जो उसको फेस में एक्जिमा था, उनकी कोई भी हिस्ट्री में कैंसर नहीं था, फिर भी उनको बहुत अच्छा रिलीफ हुआ। आज मतलब 5% जितना बचा है।
हाँ हाँ। और नेल सोरियासिस में दे सकते हैं?
समझ में नहीं आ रहा है मैम आपकी आवाज।
नेल सोरियासिस के पेशेंट में कार्सिनोसिन दे सकते हैं हिस्ट्री में कैंसर ना हो तो
नहीं,
भी
दे
या
सकते हैं
फिर
मैम,
भी?
दे सकते हैं, दे सकते हैं।
हाँ थैंक यू मैम।
मतलब ऐसा जरूरी नहीं है कि कैंसर हो, अस्थमा हो तो ही हम कार्सिनोसिन दें। ऐसा जरूरी नहीं है। अगर हमें कॉन्स्टिट्यूशनली अगर मैच लगती है, इंडिकेशन है, तो फिर हम कार्सिनोसिन दे सकते हैं। मैंने 2 पेशेंट में दिए, एक में कैंसर की हिस्ट्री थी, एक में कैंसर की हिस्ट्री नहीं थी, फिर भी दोनों को अच्छा रिलीव हुआ है।
मैम,
ओके।
मेरा एक क्वेश्चन है, अगर हम लोग जैसे कोई भी साल्पा मेडिसिन हो, बाथूजा हो, इसका हम लोग एंटीडोट मेडिसिन होता है ना, एंटीडोट मेडिसिन,
हाँ
तो
हाँ हाँ।
कार्सिनोजेनिक कौन क्या होगा, कॉम्प्लीमेंट्री मेडिसिन क्या क्या है?
एंटीडोट मेडिसिन। हेलो। हाँ सर, आपकी आवाज नहीं आ रही है प्रॉपर।
सर, मैडम को दोबारा पूछ दीजिए, आपका थोड़ा सा मैम को समझ में नहीं आया है।
ठीक, ऐसे लगता है नेटवर्क इशू हो गया। हेलो।
हाँ बोलिए ना।
हाँ, मैं पूछ रहा था जो आपका जो एंटीडोट मेडिसिन है,
हाँ।
क्या देंगे वैक्सीनेशन के टाइम पे? अगर कोई मेडिसिन हम लोग को फेल करता है, तब हम लोग करते हैं ना जो उसका एंटीडोट यूज करते हैं ना, चाहे हम लोग का हेपा सल्फर हो, चाहे हम लोग फॉस्फोरस हो, सबका एंटीडोट एंटीडोट रहता है मेडिसिन,
हम्म।
कॉम्प्लीमेंट्री मेडिसिन रहता है, तो इसका क्या होगा कार्सिनोसिन का? कार्सिनोसिन का हम लोग कैसे देखेंगे, इसका कितना दिन के इसको वेटिंग पीरियड रखेंगे, इसका फीडबैक कैसे आ रहा है, तो इसको हम कैसे देखेंगे?
मतलब कार्सिनोसिन एंटीडोट मेडिसिन पूछ रहे हैं ना?
हाँ मैम, हाँ हाँ हाँ।
एक्चुअली मैंने कभी कार्सिनोसिन को एंटीडोट करने के लिए कोई मेडिसिन दी नहीं है अभी तक, पर्सनली नहीं दी है।
हेलो।
आपको।
हेलो। हेलो।
हेलो। हाँ।
हाँ मैम, डॉक्टर प्रतिभा बात कर रही हूँ मुंबई से।
यस
मुझे एक
यस।
क्वेश्चन है।
हाँ।
सो कार्सिनोसिन के डोसेस मुझे एक्सप्लेन कीजिए। हम जब स्टार्ट करते हैं, पता है फाइनल 100% कार्सिनोसिन है, तो क्या सीएम से स्टार्ट करना चाहिए? एंड सीएम से अगर करते हैं तो व्हाट इज द डोसेस ऑफ एवरी मंथ या वीकली, कैसे रिपीट कर सकते हैं?
डोसेस में ऐसा है कि हम 200 से स्टार्ट कर सकते हैं। नो स्टोर है इसलिए 1 ml नहीं दे सकते फर्स्ट। अगर मेडिसिन के बराबर ओके हो, अगर पेशेंट को कंटिन्यूअसली इम्प्रूवमेंट हो तो फिर रिपीट नहीं करना चाहिए। जो मैंने फर्स्ट केस बोला ना माइग्रेन के लिए, उसको मैंने शायद 1.5 मंथ, 1.5 महीने के बाद उनको रिपीट की थी। मतलब फ्रीक्वेंटली रिपीट नहीं करना चाहिए। अगर पेशेंट को इम्प्रूवमेंट है तो फिर रिपीट नहीं करना चाहिए। जो दूसरा वाला पेशेंट है जिनको एक्जिमा था फेस पे, उनको भी शायद 2 महीने के बाद मैंने रिपीट की थी बाद में, क्योंकि उसकी एक्शन स्टॉप हो गई थी। मतलब जितना इम्प्रूवमेंट था उतना ही था, आगे हो नहीं रहा था, इसलिए मैंने दूसरी बार दी थी।
ओके, मिनिमम से 200 से ही स्टार्ट करना है, राइट
यस।
ना?
200
ओके।
200।
एंड रिपीटेशन 200 का भी हो तो वो डेली बेसिस 3 TDS में नहीं देना चाहिए, या ओनली 1 डोज देना चाहिए,
नहीं नहीं,
सिंगल डोज?
ओनली 1 डोज। ओनली वन
ओके।
डोज
एंड रिपीटेशन फॉर दिस 200 डोज कितना बार रिपीटेशन कर सकते हैं? ज्यादा नहीं, 1 या 2?
ज्यादा नहीं है। नहीं नहीं,
ओके।
1.5 महीने 1 महीने में रिपीटेशन कर सकते हैं।
ओके। एंड फिर आगे अगर पेशेंट्स का कैसा क्यूरेटिव है, वो अगर सिम्टम अच्छे हैं या रिलीफ नहीं हो पा रहा है, तो हम बाद में बढ़ा सकते हैं 200 से 1 m, जैसे है 10 m।
दे
मतलब
सकते।
ये एनालिसिस सिम्टम के ऊपर से ही कैसे उसका है नेचर एंड एवरीथिंग,
हम्म।
वो रिपीट कर सकते हैं 1 m 10 m।
1 m, हाँ दे सकते हैं रिपीट, लेकिन कैसा कर सकते, लाइक कैंसर ने बोला था कि डिक्रीजिंग पोटेंसी। तो अगर आपको एक पोटेंसी से रिजल्ट मिला है, बाद में
हम्म।
एक करेक्शन स्टॉप हो जाती है, तो आप उसके डिक्रीज डोज, लेकिन 200 दी थी तो फिर 30 देकर देखिए एक बार। तो फिर नो शॉट में ऐसा करना चाहिए, अकॉर्डिंग टू मी कि 200
ओके।
दी है, अगर एक्शन स्टॉप हो गई तो एक बार 30 दे के देखना चाहिए कि अगर इंप्रूवमेंट स्टार्ट हो तो फिर हमें 1 पर जाना ना पड़े, इसीलिए नो शॉट है इसीलिए।
अच्छा, नोजोड एंड सार्कोड में सेम लागू होता है कि हम डायरेक्ट सीएम में पोटेंसी नहीं दे सकते, राइट?
यस यस।
ओके ओके, थैंक यू थैंक यू।
ओके मैम।
मैम एक क्वेश्चन ऐसा है कि अगर ये जो कार्सिनोसिन में जो अगर पहले लाइक ऐसा जो पेशेंट है जो एक्यूट हो चाहे वो क्रॉनिक हो, कॉम्प्लिकेशंस या कोमार्बिडिटीज देने के बाद कुछ ऐसा कुछ फेस कर सकता है मैम, जो आपने आपका क्लिनिकल प्रैक्टिस में एक्सपीरियंस किया है देने के बाद, मतलब ये जो मेडिसिन प्रिस्क्राइब करने के बाद?
नहीं, मेरे केस में तो कभी एग्रावेशन आया नहीं है कार्सिनोसिन कार्सिनोसिन पेशेंट। अगर
अच्छा
उसको एक्यूट कंपेन हुई तो फिर मैं कॉम्प्लीमेंट देती हूँ, उसकी जो भी आजू बाजू की आस पास की दवाई
अच्छा
को कॉम्प्लीमेंट मेडिसिन देती हूँ।
अच्छा 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 मैम। So, any other participant want to have any other talk with ma'am? किसी को अगर
मैडम
कुछ
हम
डाउट है तो पूछ सकते हैं। हाँ हाँ
हम
जी
लोग
सर।
सेकंड
ओके सर।
सेकंड सेकंड पार्ट कब आएगा?
हाँ जी सर।
आपका मैडम का वेबिनार का सेकंड पार्ट कब है?
Sure sir. With the acceptance of ma'am, I think we can continue with some more lengthy time as we have the restricted time today of 1 hour. So we can do second part ma'am with your permission.
यस।
Okay, ma'am. So we will contact you, ma'am. We will have the date soon. And जी सर, तुरंत मैडम का जैसे भी हो, मैडम का फिजिबिलिटी देख के we will arrange the part 2 sir.
श्योर मैम।
थैंक यू सो मच मैम, थैंक यू सो मच।
One of another questions. So, any
यस।
medicines for fibroadenoma? One of my friend is she is a woman homeopathic doctor, but she is having a fibroadenoma. So, any medicines or any curable chances for this particular disease?
I have no cases of not seen cases of fibroadenoma, but क्योर तो नहीं बोल सकते, लेकिन सिम्टम्स रिलीव कर सकते। आई हैव टिल हैड नो एक्सपीरियंस ऑफ फाइब्रोएडेनोमा केसेस ऑफ क्योर, लेकिन
यस, मैंने भी
सिम्टम्स
वैसे
रिलीव कर
सेम
सकते।
पढ़ा है। पैथोलॉजिकली मैंने भी वो फाइंड आउट किया एवरी बुक्स में एंड एवरीथिंग, अपने इवन मटेरिया मेडिका एंड एवरीथिंग। अभी तक मैं मुझे केस कोई क्यूअर है ऐसे फाइंड आउट नहीं हुआ है होम्योपैथिक मटेरिया मेडिका में।
नहीं, मैंने भी
मैम
पर्सनली
तो
उसका
ऐसे एक्सपीरियंस
मैम
नहीं
उसका
किया।
सी ए
सिम्टम्स
125 का रिजल्ट क्या है? हाइब्रिड का CO 125 रिजल्ट क्या है उसका? आपने मेमोग्राफी किया था, उसका रिजल्ट क्या है?
हाँ, यस। नहीं, साइज है ना 2.5
मेमोग्राफी क्या है?
सेंटीमीटर तक है। थर्ड
उसका
थर्ड
एफडीजी उसका पेट सीरीज में एफडीजी कितना आया है एफडीजी?
एफडीसी अभी मेरे पास वो रिपोर्ट है लास्ट, वो
टू
देखना
मिनट।
पड़ेगा मुझे, लेकिन है एवरीथिंग इज है जो भी रिपोर्ट्स है।
अच्छा अच्छा।
हाँ।
तो मैडम
एंड
सेकंड पार्ट में हम लोग डिस्कस करेंगे, सेकंड पार्ट में डिस्कस
यस,
करेंगे।
या थैंक यू।
Sure sir. Within no time we will have some feasibility to arrange the second part also. And in the second part, we'll have the more discussion session also to clear the all the dignitaries' doubts as well. So, respected participants, so soon your questions all will be answered within a part two section. Whether जैसे कि मैम का feasibility देख के we will arrange soon, and you can also join with us for the exclusive updates for the upcoming webinar series along with ma'am and along with other dignitaries also. So we welcome you all to the board of the Asia. And thank you so much, ma'am, for the wonderful session. It was quite enlightening, and we have. I hope the participants who attended they'll have a great session today for them, as well as they also cleared the doubts, including me. And thank you so much.
Thank you so much to you, ma'am, for providing such a platform to share my knowledge.
Thank you, ma'am. Thank you so much. Thank you, all the participants. Hope you also seeing you well. And I think there is a question. Yeah. Thank you, ma'am. Thank you so much. And thank you,
Hello.
all the participants. Yes. We'll be right back soon. Yeah. Thank you, ma'am. Yeah.
Okay.